Hi, Miss Good. My name is Anna. I'm a student physical therapist that will be doing Keisha's evaluation today. How are you?
I'm doing well. How are you?
I'm good, thanks. So I just want to recap some of the things that you've told me about Keisha. She is a 3-month-old, born at 33 weeks. Her adjusted age is 1 month and 1 week.
Mm-hmm.
You had some birth complications. You had preeclampsia, and Keisha was twin A of twin B. Twin B had some post-birth complications, correct?
Yes, that's correct.
Okay. She stayed in the NICU for about 6 weeks.
She did.
Okay.
Yes.
And she's been having some recurrent ear infections, but you're following up with your ENT next week.
Correct. Yes.
Cool. So you had also mentioned to me that Keisha has a preference to look towards her right side when she's playing and she's sleeping.
Mm-hmm.
You've also noticed this flat spot on the back of her head on the right side.
Yes. Yes.
Okay. So now that we've got that covered, we can go ahead and move on with the evaluation, okay?
Okay, great.
All right, Ms. Good. So I just finished up Keisha's evaluation, and I wanted to share with you some of the findings that I've got. So based off of the way that Keisha is moving and her strength and her functional abilities, there are signs and symptoms consistent with a left-sided congenital muscular torticollis.
What is torticollis?
Okay. Yeah, so torticollis is basically the position of the head or the neck based off of muscle tightness. And because of that, there are some limitations in the way that she's moving her head. So when I tilt her head from side to side, she's got more movement when tilting her head to the left than with tilting her head to the right. And when looking left and right, she's got more motion going to the right than she does the left. I also noticed that flat spot that you had told me about earlier on the right side, and what you had said earlier about her liking to sit in that right rotated position. I did notice that as well when she was laying on her back. I also noticed, I'm not sure if you have at home, but her left shoulder and her left hip are kind of scrunched up in a flexed position. And so to me, that just shows that there's a global tightness on the left side of her body, okay?
Okay.
So based off of the objective findings today in the evaluation, I am using a clinical practice guideline used commonly in pediatric physical therapy to grade the severity of torticollis, and I am putting Keisha at a grade 2, and that is because she was referred to us at 3 months old, and her passive range of motion of cervical rotation, which was looking left and right, is a difference of 20 degrees. So before we move on, did you have any questions about the evaluation?
No.
Okay, great. Okay, Miss Good, there is a stretching exercise that I would like to send home with you today. So the purpose of this exercise is to stretch out Keisha's left side of her neck, because that muscle being tight is what's causing the bending and the rotation position that we're seeing. So I'll go ahead and show you. I'm taking my right hand and putting it on Keisha's left shoulder so that her shoulders don't turn when I'm stretching her neck. I'm taking my left hand and I'm putting it at the top of Keisha's head. I'm going to stretch that muscle by bringing Keisha's right ear to her right shoulder. I'm holding for a couple seconds, and I'm coming back, and I'm going to stretch it again, right ear to right shoulder, and back. How about you try now?
Okay.
1. Okay, try using your right hand and placing it on Keisha's left shoulder so that her shoulders aren't moving when you're stretching her neck. Now go ahead and try again. Good, that looks great. Okay, so those stretches looked great. You had mentioned earlier that Keisha does really well with the diaper changes, right?
She does.
Alright, so during diaper changes would be a perfect time to incorporate these stretches throughout the day. The goal would be to do 8 to 10 times a day with 10 repetitions per time you're stretching.
Okay.
1. So you had mentioned that Keisha loves to be in the supine rocker at home when she's taking naps or watching her brother play. Okay, so this is another opportunity to work on stretching, more of like a static stretch while she's in that rocker, which she really enjoys. So I'm going to use a towel because this is what we have in the clinic, but at home you can use a thin washcloth or a thin baby blanket, whatever you have on hand. And what I'm going to do is I'm going to use my hands to position Keisha in a neutral head position. So taking her out of that tilt and rotation. And I'm going to use this washcloth to build up a barrier to keep Keisha's head neutral. I'll take this one here. That way she can be in that rocker for 2 hours at a time, and we're still working on stretching that left side. How about you try?
So I can do the positioning technique while she sleeps, right?
Well, no. Safe sleep practice is baby by themselves in the crib without any neck pillows or blankets or barriers set up. So it would only be appropriate to do the positioning technique while she's in that rocker for 2 hours at a time.
Okay.
Okay, did you have any questions about the stretches or the positioning technique before we end today?
Nope.
Okay, great. Well, I will see you next week for her next appointment.
Awesome.